Doctors of Reddit, what is the biggest lie your patient has ever told you? EMT, not the patient. But, the wife, was getting the patient to take him to the doctor. I asked him if he could stand. The wife told me he hasn't walked in 30 years. The dude stands up unassisted and walks to the stretcher. I've been in this work a long time and simply don't give a frick about a lot of stuff. So, I just blurt out, holy shit, it's a miracle. I was prepared to get in trouble. Never happened. When I was an intern, I was doing my rotation and a woman in her late 30s or so came in complaining of nausea and lower abdominal discomfort for the last few days. I did the diligent history taking and of course asked her about the possibility of her being pregnant. She lost her shoot and went off on me. Said she was a lesbian woman and had not been with a man for 10 plus years. Yelled at me to get my boss and let an adult treat her. I reported back to my attending and delineated the tests I wanted done. He was like, I didn't hear a plan for a pregnancy test. And I was like, I don't think that's needed. She's a lesbian and hasn't been with a man in 10 years. My attending smiled and said, humor me. Bitch was pregnant as frick. Went back to her room and there were two dudes mean mugging one another about to fight. She couldn't even look me in the eye. A few years ago, a man came in complaining of a terrible cough, chest pain, and fatigue. I asked him if he had a history of smoking. Naturally he said no. Around an hour later, on my way home, I stopped to get some food and there he was, smoking outside McDonald's. I don't drink a lot of water. The patient was drinking 21 bottles of water a day and was making herself hyponatremic, low sodium in the blood. She was basically diluting herself. This can lead to lethargy, seizures, death. The medical diagnosis is called psychogenic polydipsia. Patient presented with unrelated complaints, but on the standard intake for our clinic we were to ask whether the patient had used any injected drugs in the last month. He was wearing a short-sleeved shirt. As I asked, he looked down at his arms, exposing his numerous track marks or syringe puncture wounds on his arms. He then looked up at me, crossed his arms obscuring many of the track marks, and proudly stated, nope, never. Not a doctor, but I work in an had someone come in and was acting erratically from the get-go. Went back into his bay and he was with his lady friend and they were looking at mosquito bites along their arms and legs. He went on to tell me about how they go hiking every Sunday and get torn up by bugs, but every single bite on both of them was scabbed and along a vein. Not a doctor, but in college, my roommate who I wasn't particularly close to showed up in our room stumbling around drunk. There had been a home football game, so I didn't think anything of it. An hour later she's acting dangerously drunk, but was insistent she didn't have anything to drink, so I decided to take her to the Turns out she's diabetic and didn't think that was an important detail to mention to the doctors at any point in the 3 hours we'd sat there. The doctor only realized it when her blood tests came back, although she admitted that she's known for years and took daily insulin shots that she also never told them about. I'm a veterinarian and people do the same shoot. Dog comes obviously intoxicated with something, and you ask if he could have possibly consumed X drug depending on the dog's symptoms and people don't want to admit anything. I don't care WTF you do to yourself, have at it, but don't let the dog suffer by not being honest and therefore preventing, or at the very least delaying appropriate treatment. Does Munchausen by proxy stories count? One of my father patient kept coming back with her daughter's mysterious illness. The kid was grey. Like from head to toe, her skin had a grey-blue tint. Mother swore it happened overnight and nothing could explain it. Yeah, right. My father recognized silver poisoning and had the kid tested. A few calls to his colleagues in the area confirmed that the woman had been touring doctors, disappearing every time argyrism was diagnosed. The mother was feeding silver powder to her kid for retention. I had a lady in the hospital who was several days post-op and had met all criteria for discharge. This can be a somewhat difficult situation because you want to maintain a good relationship with your patient, but at the same time can't inappropriately use hospital resources. I told her that, if there's no medical necessity, insurance could deny payment for the extra night in the hospital. To which she said, "Oh, my health insurance agent was just up here, and he said I should stay another day." I just stared at her for a minute, since I have never seen an insurance representative in the hospital, and don't even know if health insurance agents exist. She then admitted that she just made that up. Not a doctor, but I was a nurse scribe. I would follow the doctors around with a laptop and do all of their electronic charting, ordering tests, note taking and stuff like that. Had a patient, probably around 18 to 20-year-old male, complaining of a foreign object in his male organ. He had a set of iPhone headphones stuck up his penis. And when I say stuck up there, I mean all the way to where the single cord splits in two for the two earbuds. Out of precaution we did an x-ray and sure enough, you could see the knotted up cord in his lower abdomen. And it was going to require surgery to remove due to it being tangled. He said that he was at a party with some friends and that he got drunk and passed out, and his friends shoved it up there as a joke while he was passed out. Luckily the doctor I was working with had seen this guy for the same thing not long ago, except before it was a wire coat hanger. She recognized there was a bigger issue and convinced him to have an inpatient psych consult in the ER after surgery so they could get him the help he needed. Not a single person in that exam room bought his story that his friends did it to him though. As a paramedic, a woman was shot. We arrive on scene, and she has a single gunshot wound in her right thigh, minimal bleeding, and she is standing up and limping while talking to the police. She is very polite and nice, and thanks us for coming to help her. She said she was walking in the parking lot of a restaurant when she saw a blue car drive by and someone leaned out with a pistol and started shooting, and she felt something hit her leg. We help her to truck, and I bandage her wound and give her some pain medicine, and on to the hospital we go. She jokes about she's in the wrong place and the wrong time and is having an unlucky day. Answers questions with yes sir/no sir, even though I told her she didn't have to. We arrive at the ER and I'm giving my report to the trauma team when an officer on scene quietly comes into the room. I'm telling the patient's story to the docs when the cop gets this huge grin on his face, then nods at me to come outside. He told me that a blue car pulled up just when we left scene and told them to go check the restaurant cameras. The cops check the camera to find my patient inside the restaurant and suddenly starts to yell at the other person, driver of the blue car. The other person leaves the restaurant trying to get away, and my patient is chasing her. The video from the parking lot then shows my patient going to her vehicle and getting a pistol out. She then starts to run after the other person. There's a flash on the camera and the patient starts limping. She shot herself in her leg. Me. Do you smoke? Part. I'm afraid so. Doc looks sheepish. Me. Do you smoke anything other than tobacco? Then explaining to medical student how cannabis is associated with certain conditions. Part shocked and virtuoso no. Doctor, the very idea! Exclamation point. 5 minutes later. Me. Mr. Part, when I asked you to get undressed I meant that I would need your shirt off. Part channels 5-year-old child looking at the floor and mumbling, takes shirt off to reveal a massive cannabis leaf tattoo on his chest. Only a medical student, but a patient I took history from wanted Ativan for anxiety. She was telling me about how her panic attacks are so bad she gets into car accidents with casualties every week. I mean, a lot of patients will tell lies or play coy to get controlled substances, but she was the only one who admitted to multiple counts of vehicular manslaughter. When I presented her case to my attending, she showed me a note in the EMR from another doctor stating this was a regular tactic of hers, as well as an extensive online list of every script different doctors had given her for controlled substances. She didn't get an Ativan prescription that day. I once informed my pediatrician that I had contacted malaria from a mosquito bite and needed to miss math class to drink quinine please. I was not bright as an 8-year-old. Well, bright enough to learn about malaria out of a Little House on the Prairie book, but otherwise, nope. Hi and Lois, story of my life. The pediatrician had my mom give me a glass of tonic water each morning before 2nd grade. Said it had plenty of quinine and would keep me safe from malaria. Unexpected consequence, I still love the stuff and drink it straight regularly. In my first crappy job I would take sick days constantly. I learned how to fake certain symptoms, have a cracked voice and all that. I always wondered if the doctor saw through my shoot but did not want to call me out or just did not give a shoot at all. Because one day I went to another doctor, he called me out and sent me to work. Funnily enough, I actually became sick the very next day with flu, came back to the same doctor and he apologized that he never knows for sure and there are a lot of people faking symptoms to get things in flu medicines that you can make meth out of. Right now when the patient said no doctor has seen them since they got admitted when I personally saw them 2 hours ago. Not a doctor, but a former patient who once told a weird lie that I was dead as called out on. I had braces as a kid, and I had a bad habit of chewing on pen caps, which would occasionally result in one of my brackets coming uncemented from its tooth. So for the upteenth time, this happened, and my orthodontist got ready to read me the riot act, but then I told him that, actually, I had been at a birthday party at a restaurant that had a dance floor in the back, which was true, and that I tripped and fell and hit my mouth on the wooden railing that lined the perimeter of the dance floor in such a way that I didn't hurt myself. I just knocked a bracket loose, which was absolutely a lie, and he was like, "So you fell into a wooden rail and you hit your mouth into it, full force, but you didn't lose a tooth or bust your lip or anything else? Is that what actually happened?" And then I looked at the floor and shook my head no. Yikes, I don't understand why people would lie to their doctor. At best it makes their job unnecessarily difficult, and at worst the treatment could be wrong or dangerous. I really did get a light bulb stuck up my butt from falling onto it though. I don't recall why I wasn't wearing any pants.